But for those of you who don't know these two fine gentlemen, these two fine doctors, Dr. Stephen Haering is someone we know in Alexandria because he's the director of the Alexandria Health Department. And it's become quite famous locally, I think, now. This is actually my second Zoom with you, sir, since COVID began. Dr. Danny Avula is the vaccine coordinator for the Virginia Department of Health. So he knows what's going on throughout Virginia and maybe can answer some questions at the federal level as well. We're about to get started, 61 participants, but I don't know, just briefly before we get to real start, Dr. Haering, if you could just introduce yourself and maybe how long you've been the director at ADH and just kind of what you're seeing here. Go ahead.
Sure. Delegate Levine, thank you for having me on board. And it's good to see you, Danny, to be here with me. I've been with the Virginia Department of Health since 2008, and I've been the director of Alexandria Health Department for 10 and a half years. I'm really excited about the phase that we're going into, that we've just kind of taken baby steps into, because I think that we're starting to see some light at the end of the tunnel. But I do want to start with, I'll say it in the middle and I'll say it at the end, is we still have a long way to go, and we can't give up those mitigation strategies. Our numbers are off the chart right now in terms of the number of cases that we have. So again, thank you for having me here today.
Thank you, Dr. Haering. Dr. Avula, how long have you been, do we have a vaccine coordinator? I think, is that a new title?
I've been the vaccine coordinator for about 9 days, Delegate Levine. but prior to that, I was a local health, and still am a local health director in Richmond and Henrico County here in Central Virginia. Been working with my colleague Steve for the entirety of that time. I've been with VDH for 11 years. You may not know, but Steve and I date back even before that. He has been a longtime friend and mentor to me. He was my chief resident at Johns Hopkins over a decade ago. So we go back, and you've got one of the best.
Well, let me start. And I think at this point with our 64 participants, it may even grow further. Let me start with the basics. And that is, well, the single greatest question I get is, when am I gonna get my vaccine, right? So here's what folks wanna know. It's confusing. We have the 1B, which is 75 and older, but now 1C is 65 and older. It seems to be conflated now with 1B. We've got 1664 with special conditions. We have all the priorities. And then the biggest question I get from folks is, if they're eligible, what do they do next? How do, probably every one of the 65 people watching this now, including me, we all want the vaccine yesterday. What is the best way to find out, not just if you're eligible, but to actually get a vaccine? So I can tell you what, let's start with Dr. Avula to give the broad Virginia outlook, how we're doing, how many vaccines we have, how many we're distributing, what's our time frame across the Commonwealth, and then I'll go to Dr. Haering to find out specifically how can an Alexandrian get a vaccine tomorrow, if not sooner. But let's start with Dr. Avula. Tell us overall how we're doing.
Sounds good. So, vaccine began delivery here in Virginia about the middle of December. We started getting trickles of vaccine in. And remember, at the time, we knew that vaccine was going to be a scarce commodity, and we knew that there had to be some kind of prioritization because we weren't going to have vaccine for everybody who wanted it at one time. So we went through a very rigorous process following CDC guidelines at the state level, really trying to determine who was going to be at highest risk and how do we move through those categories. That 1A category consisted of the residents of long-term care facilities, folks in nursing homes and assisted living facilities, because we have seen COVID ravage those communities over the last year. We know that's where we've lost the most lives, where we've felt the greatest impact. So clearly, residents of long-term care facilities were at the top of that list, along with the staff of those facilities, because often that's how COVID was finding its way into those nursing homes and assisted living facilities. In addition to that, our healthcare workers, folks who are treating patients with COVID every day, and not just the healthcare providers, not just the nurses and doctors, but also the dietary staff, the folks who are the janitorial staff that are turning rooms over as patients come and go. So we really wanted to focus on those two categories in 1A. 1B went to kind of the next tier of folks that our society can't really move forward without. Those essential personnel, our police and our fire, our teachers and childcare providers, folks who work in food service industry. There's a number of other categories in 1B. And then the elderly, because again, we knew that the elderly were the residents who were most vulnerable. And that was initially defined as 75 and above. What happened this past just a couple of days ago, we've been hearing messaging from the federal government that we really need to open up not just 75 and above, but 65 and above. And in addition to that, people ages 16 to 65 who've got underlying conditions. And while I think the sentiment was right, what is really putting us in a difficult place now is that there's just not enough vaccine. I mean, the issue that we knew was there in the beginning, a limited supply, persists now and is actually even more in short supply. We were hoping when that announcement came from the federal government, when that guidance came to all of the governors across the state that we should include these categories, that guidance came with hope that they were going to release these reserves of second doses. And now, now we're hearing in the last 24 hours that reserve didn't exist and that there's not really going to be a change in the amount of vaccine allocated to all of the states. And that is a tough place to be because now we have 4+ million more Virginians who are now eligible for vaccine, but no more supply to help meet that demand. And so,
Dr. Avula, there's about 8.5 million Virginians. 4 million of us are eligible. That's half of us. And as you point out, as we just learned, the federal government promised us a certain supply of vaccine that apparently does not exist, or at least doesn't exist at this time. No one has to ask me any tough questions about the competence of the current administration. I have not been exactly praiseworthy of them at all, but we are where we are. How many vaccines do you have? Let me just get some raw numbers here. How many people have been vaccinated? How many vaccines are available? Because if you've only got 100,000, 4 million may be eligible, but very few of us are getting the vaccine. So how many have been vaccinated? How many vaccines do you have available? How many are coming day to day?
Yep, great. Okay, so to date, our state has received 943,000 doses of vaccine. 295,000 of those doses have actually been registered as administered to individuals. So that's a big gap. And so let's talk through a little bit of that gap.
600,000 plus that haven't been.
Say that one more time.
600,000 plus vaccines that you have right now that have not been put in people's arms.
Well, not exactly, but I'll kind of break that down real quick. Yeah, but that's how the data appears. That's the right interpretation for the public, is that there's 600,000 doses that we don't know what's going on with. So that is one acute problem that we've got to figure out and figure it out quick. Where are those 600,000 doses, and how do we make sure that we have tracked and put those, given those to individuals who need them? The other problem is the amount of vaccine that's coming in every week. And so to your question, we're getting about 100,000 new doses per week. This week, it was 106,000 doses. The requests for those doses from hospitals, health departments, private docs, pharmacies far exceed that. We got over 300,000 dose requests this week. And so nobody is getting what they're asking for because we only have a third of what the demand is through those different channels. So let me talk real quick about the 600,000. Now, in any given week, a new allocation comes, and then all the providers who receive that have about a week to actually administer those vaccines and then log them into the system. So, that's about 150,000 this past week. And I'll clarify the discrepancy between 100,000 and 150,000 in a second. But 150,000 that were distributed last week that will give time for them to actually do the events and log the data. And then there's about 200,000 of those doses that we don't have any control over, but were distributed to Cvs and Walgreens as the vaccinators for our long-term care facilities. And so they're moving along at their own pace. And some of that is going very well. And in some parts of the state, it's not. But that's completely out of our control as Cvs and Walgreens control that supply and are getting through those populations as fast as they can. So, of the remaining 200,000 to 300,000 doses, that is what we are figuring out right now. And what I've found is I've talked to health departments, health systems, and providers who have received this vaccine, is there's a couple different things at play. In many places, they've actually given the vaccine, but have not logged it into the system. All of the information has to go into a state database called the Virginia Immunization Information System. And that entry into VIS is what gets us to the fact that we have 295,000 doses administered. That's where that data comes from. And so what we've been ultra clear this week with anyone who's receiving vaccine is that it has to be a priority to get that data entered. Otherwise, it's going to impact how much vaccine you get the following week.
So we
That's
don't know
issue
how
one.
much of the 600,000 you felt like 300,000 or so is at Walgreens, CVS, and the others may well be just not entered into the system yet. We don't know.
Not all of it, but a good chunk of it. If I had to guess, I would guess about 100,000 doses have not yet been had been logged into the system, and so that accounts for some of that gap.
Okay.
Now, in some parts of the state that have not progressed to 1B, you have health systems that have and other providers, health systems and health departments that have received a lot of vaccine, got through their 1A population, but have felt restricted, like have not felt the freedom to get it out to a broader population. And so I've talked to two particular health systems, one that had over 40,000 doses on hand, one that had about 8,000 doses on hand. They were in 1A communities. They'd gotten through all of their 1A providers, but didn't feel like they could move on and open up clinics for 1B. And so that's part of why we are pushing, and most of the state will be going to 1B next week, but that should free up any restrictions that the health systems and the health departments are feeling to move to those next risk categories.
The last question, then I want to get to Dr. Haering, and that is a very simple one. How many 1As are there in Virginia, approximately?
I don't know that number off the top of my head. I know that, gosh, Steve, do you know? I should know that. I'm sorry. I will.
Just trying to figure out when you say 295,000 vaccines administered, is that almost all to 1A? I suspect it is.
Yeah, so the vast majority of our vaccination has happened through hospitals and healthcare systems. And that's an important point too, that, initially when the first allocation went in, hospitals told us how many staff they had, and we allocated 100% of that staff. And the reality has been that not 100% of healthcare staff want the vaccine. Initially the uptake has been somewhere between 50 and 60%. And so that has led to scenarios where health systems have had a lot of additional vaccine because they just haven't had the uptake that they were hoping for. Now that's improving. You've got a second round of healthcare workers who've now watched their colleagues get the vaccine. They haven't seen any significant side effects and they're like, okay, I'm ready now, I'm gonna get the vaccine. And so now that second wave is coming. But that is some of the challenge. I think the number is 600,000 statewide, Delegate Levine, but I'm gonna look it up while Dr.
All right. Let me move on to Dr. Haering. Would love to know locally how we're doing at Alexandria, and if you happen to know Arlington and Fairfax as well. I believe because we're on to 1B, Dr. Haering, that we've basically vaccinated all the 1As, or at least virtually any 1A who wants it in Alexandria, and that's why we're moving on to 1B. Is that correct? And if so, how many 1Bs have we vaccinated? And what do I tell the now 80 people in the room listening to us about when they can get theirs?
Sure. First of all, and I can only speak for Alexandria in terms of numbers and whatnot, because I don't know for Arlington and Fairfax. I can say for Alexandria, just like the other 4 Northern Virginia health districts, we're part of the 11 health districts, health departments that moved into 1B effective this past Monday. And part of the allowance of being able to move into 1B is, like Dr. Avula was just describing, we were at the point where we were having pods. A pod is a point of distribution. It's a vaccine clinic. We were having pods for our 1A people. And for Alexandria, to give you an idea, there are 20, I'm going to round numbers, there's about 2,400 1A folks who work in the hospital system. And there's over 10,000 who work outside the hospital walls, or outside the ANOVA system, if you will. And so we were charged with vaccinating those 10,000, and that's how we based our initial request for vaccine. That being said, we found out after several of our pods, and each pod, depending on the number of vaccinators that we have at the pod, vaccinate anywhere from 400 to somewhat over 800 people. And we were finding our pods weren't completely full with appointments. So that's when we in Northern Virginia petitioned Virginia Department of Health late last week to move into 1B, and they I would say very wisely said, yes, let's move into 1B where you've already tapped out the demand from a previous category. And now the message has been very clear from the governor's office and the secretary and all the way through the commissioner is that if you have vaccine, you use it. We still have those priority areas, Delegate Levine, that you described before. To answer your question about when can I get vaccine, a lot of it.
I just want to make clear because we're using some technical terms, and I just want to make sure everyone knows 1A is basically people who work in healthcare. More or less, it's people who work in healthcare. 1B is people 75 years and older and people in high priority professions, people like firefighters, police, teachers, agricultural, people who are in close proximity to each other, who sort of need it. That's group 1B. Group 1C is everyone 65 years and older, and those age 16 to 64 who have health conditions that make them more likely to need the vaccine. And I should note those health conditions are pretty large. I looked at them, and if you have a body mass index of a certain level, that it probably includes many of us, maybe half of us, you're eligible as well. So it's a massive number of people who are now eligible. And then, as Dr. Avula pointed out just yesterday, in a confusing way, they sort of conflated 1B and 1C. So that's good news in that almost anyone is eligible for the vaccine, but it's bad news in the sense that you can call 100 million people eligible for the vaccine, but if you only got 100,000 vaccines, you're only going to get 100,000 vaccines. So the fact that we're opening up the priority to everyone makes everyone feel good. We're all eligible. But Dr. Haering, if I'm an Alexandrian and I'm 66, can I get ahead of someone who's 86? Can I get ahead of a firefighter? How are you prioritizing who asks you for a vaccine?
Well, that's a great question, and we're using the metaphor here that before we had buckets of water that we were dealing with, and then when we moved into 1B, we had a big pond, or maybe even a lake, and now we're kind of in the ocean, if you will. And just for clarification for everybody, actually just I think over last night, they have moved those 65 and older and those with health conditions 16 to 64 into 1B. So just for, the categorizations and all. I'm sorry?
I just posted the link that really breaks that down, the new 1B classification.
It's in the chat room. It's great. So, and by the way, I know I'm getting hundreds of questions. We will get to as many of them as we can until our doctors have to leave us. But stay tuned. I'm trying to get the basic framework down, and then I promise you I will get to as many questions as we possibly can. Continue, Dr. Haering.
So your question was, if I'm 64, can I get ahead of a firefighter? Can I get ahead of other people? This is how we're doing things in Alexandria. Is when we moved into 1B, and actually even before we moved into 1B, we were putting out information through the Alexandria e-News. Hey, this is how you pre-register. And if you're an employer, this is how you identify yourself as an employer in certain categories, and how you will, going forward, upload your employees' email addresses. So when there was the announcement this past Thursday that we were moving in, was it Thursday or Friday, that the governor said we're moving the folks that were expanding 1B, we actually already had a big list, a huge list of people that were from the original 1B. The original 1B being 75 and older. And to give you an idea how big that list was, it was about 4,300 people. So, and then... Available,
Dr. Haering, just to give us a rough knowledge, how many vaccines do you estimate Alexandria has available to put in people's arms? Right?
Yes, it depends on how you define available. So we have already booked out appointments today. We're running a pod today. We're running one next Tuesday, next Thursday, and Saturday. We've already booked all those appointments. So if you're counting those, it's 800 per day. We've also booked out half days for the following week of, that would be January 26th, 28th, and 30th. And so I say half days because that's the vaccine that we had available. We don't make appointments available until we have vaccine in hand. So does that make sense? Because we don't want to have to be contacting.
Got it. So if somebody asks you for an appointment, you don't give them an appointment until you know you have the vaccine.
That's correct. So when we get more vaccine in hand, what we'll be doing is we'll open up the appointment slots and we'll be contacting those people that are in the list, in the queue, according to the first come, first serve. And because our first come, first serve, our first people that were invited were from the original, we're always keep it open for 1A, always the healthcare workers. Our original 1Bs, which were the 75 and older, as well as folks who are in shelters. And then because we had pre-registered people, we also know the 65 and older and others. We've since changed our registration process so that it captures people according to the different categorizations. But our purpose is to really serve people that have already registered, and by nature of having been able to put out those registration processes early on, we're actually capturing those who are most susceptible for severe disease, most susceptible for needing a hospital, for instance, if they were to contract COVID-19.
So Dr. Haering, when you say we, you mean vaccines administered by the Alexandria Department of Health, or are you also including the CVSs and the Walgreens of this world?
Okay. Yes, plus. So I'm including the CVS and Walgreens because what Dr. Avula described is a federal program working with our long-term care facilities. But we've actually gone into a couple of long-term care facilities where there's independent livers, people living independently. They're not considered part of the skilled nursing facility, the assisted living facility. And we've gone in there, and I'll tell you how in a minute, and vaccinated those folks because they are, number one, elderly, and number two, they're in a congregate living facility. But then when I say we, I'm also including a very important additional aspect, and that is our community partners. And I'm not going to identify who they are right now, not because I'm being secretive, not because I'm not being transparent, but because our community partners have asked us not to identify them publicly yet. These community partners include pharmacies and they include private providers. They are reaching out to their patients. They have electronic medical records, electronic pharmaceutical records, and before we even got to the expanded 1B, they were reaching out to the 75 plus people on their, in their databases and saying, hey, I've got vaccine, and they schedule an appointment. Now they're doing that they'll be doing that for expanded numbers of people that qualify.
So break it down in a really practical way. We got people listening. We now have 79 participants. Say we have a participant. She's 73 years old, so she's 1C, became 1B. She wants a vaccine. What should she do to put her best in line? Understand that we all have to wait in line, and there just aren't enough vaccines right now, and no one's trying to break the line. But my hypothetical 73-year-old woman wants a vaccine. How should she register with you only? Should she register with you and CVS and Walgreens? Would that give her a better chance? Should she call her doctor too? She wants this vaccine as soon as possible. Is just notifying you sufficient? What's the best way to get as close in line as we can, given the shortage?
First, I'm very excited and happy that she's eager to get it, and we're just as eager to get it to her. There's a couple of ways that I would recommend. One is if she has internet and a computer, then she should go to alexandriava.gov/vaccines. There's a box on there that says pre-register for vaccines. So she'll pre-register there, or they will pre-register there, and then they're in the queue. If they're not so tech savvy or don't have internet or prefer to talk to somebody, and this is a little bit slower of a way, but the other way is to call the COVID-19 hotline. That's 703-746-4988. 746-4988. Of course, most of the people on this call are likely tech savvy, so I would encourage them to go to alexandriava.gov/vaccines and that will put them in the queue.
Is
Then,
that-
if I can answer one more,
Yeah, go ahead.
if I can answer one more, we all know in Alexandria there's a lot of seniors that really have greater need. And what we're doing is we're working with our senior serving organizations, and we're having them actually schedule appointments with our partner agencies, with our community partners who are doing vaccines, as well as in our vaccine pods. Our vaccine pods right now, what we're doing is we're reserving the first couple of hours for our senior residents. And we're also having the pharmacies and some of the community providers really focus on those, as well as those who have underlying health conditions.
So
But
should we
mostly the
also
elderly.
you, or should this hypothetical 73-year-old woman, should she also call CVS and Walgreens because maybe they'll get something sooner than you, or just registering with you, Dr. Haering, is enough to put her in the queue, and she's getting as far to the front of the line as she possibly can if she does it today?
She's getting as far ahead of and this is at this juncture. She's getting as far ahead of the line as she can at this juncture. When things change, I don't know, but there could be a point where it becomes more available, and calling her, always call your private provider and see if they're offering the vaccine. Because another thing we're constantly doing, Delegate Levine, is we're recruiting more clinicians to do it. It's unlikely that somebody a practice that doesn't give a flu shot, they're unlikely to be eligible for COVID-19 shot, because it takes certain requirements. It takes a little bit of an infrastructure, a data logger on your refrigerator, freezer, the processes to assure Centers for Disease Control and Virginia Department of Health that you know how and will be able to handle and store the vaccine to make it stable.
So it is conceivable that if someone goes to their doctor, their private provider, they might get a little bit faster than only registering with Dr. Haering?
Absolutely. And I suspect with time, and I can't predict how much time, that will continue to evolve.
Okay, so your own doctor, I'm just trying to your own doctor registering with ADH. What about CVS and Walgreens, or is that connected to you and that's not? If I go to CVS and call them, that won't get me in the line any faster.
We're having the pharmacies that are enrolled, we're having them actually call people, but I don't know that we haven't been told by the pharmacies, hey, have people call this number.
Okay, all right.
So I don't think they don't have those kinds of numbers and that kind of scheduling at this juncture. This could literally change next week. Okay. And when it changes, we will be announcing it through Alexandria E-News, the daily Monday through Friday.
When they do announce it, I'll be putting out a newsletter. So for those of you who get my newsletter, if you don't sign up, markfordelegate.com, M-A-R-K-F-O-R delegate.com, we will try to keep you up to date with the latest news. Let me circle back to Dr. Avula. Dr. Avula, one of the concerns at the federal level, and I'm sure it's true at the state level as well, is that this conflict or possible conflict between people getting their second vaccines and people getting their first vaccines. And what if there's a 1A person who wants a second vaccine, but they don't have one available because you're scheduling for 1B? There's a natural conflict there. How do you resolve that conflict?
Yeah, so the way the federal government right now is operating is that they are doing they're actually allocating first and second doses separately. So in Virginia, we're getting about 100,000 first doses per week. Now, in addition to that, anybody who has received first doses directly from the federal government previously will get an allocation either 3 or 4 weeks out of their second dose. So last week, we had a total of 100,000 or so first doses, and then about 60,000 second doses that went out in addition. So the way that the federal government is handling this logistically is that they are they're holding specific doses for second doses and shipping them directly above and beyond our 100,000 per week allocation. What we're telling
you should have trouble getting a second dose.
The way that it's designed, that's correct. But what we're telling people is use everything you have. And so offer appointments, offer the ability to get a second dose. But if people don't show up, use that for first dose. We've got to get every dose out that we can. So there is enough for second doses, but people have got to show up for those offerings when they're given.
Let me ask you, Dr. Avula, just some general questions about the vaccines. There's a Pfizer vaccine, there's a Moderna vaccine. I know the Pfizer requires super cold settings. Moderna requires cold, but not as cold. I think Pfizer is the 3-week follow-up. Moderna is a 4-week follow-up. At the end of the day, does it matter? I just want a vaccine. I don't want to be infected with COVID. Does it matter which one I get? Should I care?
No, between the two doses, the safety and efficacy profiles are pretty similar, and so and really, there's not much choice. Vaccine is in such short supply that the distribution is just it's happening where it happens, and so. But the key is that if you get a first dose Pfizer, you need to get a second dose Pfizer, and the same is true for Moderna.
Now, is AstraZeneca on the way? We don't really know.
You know, they're still in trials. I think the best case scenario, if they make it through trials successfully and the FDA approves, is probably April.
Now, you mentioned we're getting about 100,000 a week. Is that going to mount up? Will we start getting 200,000 a week, 300,000 a week, or is that pretty consistent, 100,000 a week, and that's going to stay that way for the next 3 months?
Yeah, so this comes back to me not knowing what to trust from the federal government. We are hearing so many different.
In 4 days, we get a competent government, so hopefully they'll be able to figure it out. But what's your best guess? I guess.
Yeah, so I would say the thing that feels the best that we can plan on is that we're going to continue getting about 100,000 first doses per week from now through the end of February and probably into early March. It's going to take that much time for vaccine supply to ramp up. And then in April, if AstraZeneca comes on board, that then creates another significant expansion.
So 100,000 a week, roughly, that's only 1 million or so Virginians. We've just mentioned 4 million are eligible. You have about 954,000, so roughly 2 million. So you're saying that even by April 1st, we may only have vaccinated half of the 4 million Virginians in the 1B, 1C category.
That's right.
We still have a ways to go here.
And I think my plea really would be that we think about the members of our community who need this most. And so if you are a 40-year-old who's a little overweight like myself, I'm going to let the elderly go ahead of me, because I know that those 75, those older folks who have complicated underlying conditions, that those folks are the most vulnerable. And so, you know, I know that everybody is anxious. They want to get back to some sense of normalcy, but we've got to be real about how much vaccine there is and how we need to think about it collectively as a society.
Dr. Avula, what if I have COVID? What if, you know, shortness of breath and chills and fever, low level, not in the hospital, I'm just starting to get it. Can I take the vaccine now while I have COVID and maybe it'll help me heal better, or should I avoid it till I get better?
I don't think that there's any benefit. Steve, you can jump in if I'm off base here, but I do not think there's any benefit in giving the vaccine as a kind of treatment for acute illness. There are other treatments like steroids, and if your condition worsens enough that you would need that kind of support, absolutely go to your emergency room or talk to your provider. And so there are treatments that can help change the course, but an acute vaccination will not help with that.
Could it make it worse? Could it make my COVID worse if I have it?
Let's see.
Dr. Haering?
Yeah, you know, what I'm understanding is that the advice is not to give it to people who have it, because we work with congregate living facilities, and where there's an outbreak, we actually wait until that starts to defervesce before we would start to vaccinate people.
Okay. So now let me get to some of the many questions we have, and we'll just keep going until we do. Some of these questions have been answered. I think what we basically said is it is open to a heck of a lot of Virginians, half of us, but as you point out, Dr. Avula, maybe not all of us should be clamoring for it. We should let the folks that we think are most in danger go first, which makes a lot of sense to me. Questions: how many vaccination centers will have drive-up or walk-up services so that individuals will not have to spend time in buildings where there's a greater risk of COVID infection? Maybe that's for you, Dr. Haering. Any of you drive-up or walk-up?
Having worked here 10 years and 10 and a half years, I know Alexandrians require and expect a very high standard. And one of the things that I've been very pleased with is the efficiency of my team. I've never received so many complimentary emails, quite frankly, about the service that our seniors and our frontline essential folks are getting, because some are describing from the time they leave their car and the time they get back in their car, it's 30 minutes. Because we're actually, we don't have 1, 2, or 3 or 4 vaccinators. We have 24 vaccinators. And so when you come in to our pod, the registration process is 6 feet apart from everybody else. The line is moving. Yeah, occasionally there's some stalls in the line, but for the wait time, it's very low. The space is very spacious. People are required to wear a face mask in accordance with the executive order. We take every precaution. We sanitize the area between people getting vaccinated when they sit down, and the next person comes in. We have a waiting area that's also sanitized between people sitting. So it's actually a very efficient process.
Okay, but you don't have drive-up facilities, and you don't want that or anticipate that.
We're not anticipating that, and the reason is we do have people wait in one of 2 areas if they're comfortable waiting in their car for the 15 minutes after the vaccination. We have them do that, and we have people in the parking lot in case there's a reaction. And we've had a couple of reactions, and we have paramedics responding immediately. We have our nurse respond immediately with epinephrine if that's necessary, as well as the paramedics responding immediately. We're not doing the drive-through model because it's winter, and it's very difficult also to maintain the 15-minute waiting period after people get the vaccination.
You actually raised a good point. There is a small percentage of people that are actually allergic to this vaccine, and it actually can be quite dangerous. Now, we're talking, I think, way less than 1% of people, but you do mention that you can have an allergic reaction, Dr. Haering. My understanding, and again, correct me if I'm wrong, you're the expert, is that shows up within 15, 20 minutes afterwards. If you're going to have an allergic reaction, it happens right away, and you can treat and take care of those people. And no one has been, despite the fact that there's been allergic reactions all over the world, no one, I think, has ever died from the allergic reaction. It's just something that it's a tiny percentage, and you can treat it right away.
Yeah, it's a tiny percentage. It generally, it can show up as late as 4 hours later, but the vast majority show up in 15 minutes, and even sooner than that. And it's usually things like a rash or a little bit of shortness of breath or very severe shortness of breath. But that happens very uncommonly, but we're aware of that. That can happen with any vaccine. It can happen with the shingles vaccine or tetanus. So we're prepared to respond to that. And if people need hospital evaluation, to get them to the hospital immediately as well.
But to be clear, that's like less than 1 in 1,000 chance?
Oh, it's very minimal. It's nothing like the hospitalization rate of people getting COVID-19.
Okay. Dr. Avula, there's been a suggestion, even in the press, that Virginia is slower than other states. This person wants to know, why are things moving so slowly? Virginia is ranked as one of the lowest states in vaccine distribution metrics. My understanding is that what you said is that some of this is just inputting into the system. We're not as slow as has been reported we are. I know the governor took a little umbrage at that we're actually in the middle of the pack and not at the end of the pack. But let's just be transparent. Where are we compared to other states?
Yeah, I mean, the rankings based on the numbers that are coming out, and I haven't, again, checked that ranking today. We had a significant addition, over 30,000 or so vaccines from yesterday to today that were updated into the system or newly given. But the rankings had us in kind of the mid 40s around the states. And so obviously that's a concern. Again, as I talk to the folks who have received vaccine, and I really have a sense of how much vaccine is going out the door, I think the numbers look much better than that. But I understand that that's how the rankings are determined, and the people of Virginia aren't going to change their minds until they see it. So we've got to fix the data entry issue and ensure that the systems are talking to each other. And so my priority one is to close that gap so that we don't have this false concern that there are hundreds of thousands of doses sitting on the shelves that aren't getting into people. We've got to close the data gap so people understand that the majority of those are vaccines that have been given.
Yeah, I think the data are all over the map. I remember the governor saying at his press conference that the only states that have given out more vaccines than we have are states that are larger than we are, and we're like the 12th or 13th largest state in the United States. But there's a massive difference between that statement by our governor and what's been reported in some news sources. So
well,
people
the rankings are per capita rankings, right? And so in terms of volume of vaccine that we've put out, that is correct. We are near the top.
Right.
But because we're the 12th largest state,
Right.
the per capita ranking puts us near the bottom.
Right. Question, and I believe I know the answer, but I'm going to ask you. I'll start with you, Dr. Avula, but I think it's clear. Does the vaccine protect against the new COVID variants? Apparently, the far more contagious variant that started in the UK protects against that as well, right?
It does, and thankfully, you know, we've watched that data in the UK. There are new variants coming up in other parts of the world, like South Africa. The UK epidemic has just skyrocketed over the last month and a half. But thankfully, we know one, that new variant is not any more severe. It is more contagious, but it's not more severe. And two, we know that our vaccine, at least at this point, appears to be effective against that variant. So that's heartening.
So here's the impossible question, but I'm going to ask it anyway. People want to know when it's all going to be over. They want to know when we can go back to normal. The way you described it, we're going to have another million more vaccinated, maybe by April 1st. That's only 2 million Virginians. We got 8.5 million Virginians. Maybe we'll get more with AstraZeneca in April, September, Labor Day. Where's the end of this tunnel? I know it's an impossible question.
Yeah. So if I had to guess, Delegate Levine, I mean, so first we take the 8.5 million Virginians. We look at the adult population because kids are not and probably won't be eligible to be vaccinated for 4 months at best. Pfizer, about a month, maybe a little longer ago, it opened up their trials to kids down to age 12, but we're still a few months away from being able to approve that for kids. So you take the adult population and you want to get to about 70 to 80% of the population that's vaccinated. And so our goal, if you just start to break down the map, our goal is 50,000 doses a day. Obviously, this is completely dependent on supply. And so if we are just plugging away and supply is not an issue, we could reasonably get vaccinated by June or July. With the supply issues we are having, I don't see that happening until September or October.
So is there something you look at, like a positivity rate or something? Governor Northam used to talk about, is it above 10%, is it below 10%? When we can say we are close to normal and maybe schools can reopen and maybe we don't have to wear a mask. I mean, I don't want to,
I get crazy here, Delegate.
Yeah, I know. I mean, but and listen, I'm torn because everyone wants to be optimistic. Everyone wants to tell people what they want to hear. Sure, we'll all go to school, everything. And yet I don't want to lie to people. I'd rather you give us the hard truth than rosy predictions. So, are we talking throughout 2021? We're still going to wear masks and being careful. What's your best guess? I'm ask both. First, I'll ask you, Dr. Avula, then I'll switch back to Dr. Haering. Understanding this is a massive crystal ball and y'all don't have all the answers, and it's an impossible question. But like I said, that's why I'm asking it. So
I think one of the concerns that we don't yet know about the vaccine is we know that it protects you against getting infected and developing severe disease. We do not yet know whether it prevents you from being a carrier and potentially transmitting it to somebody else. So the recommendation right now is that even after vaccination, that you continue to wear a mask and social distance. And we'll need to watch this over the next few months to see, is it working? Are there cases where people who have been vaccinated are potentially still transmitting disease? And then to the macro question, we've got to look at, what are our positivity rates? What are the case rates in our communities? And I really do think there will be a turning point that is vaccination dependent. That also has to do with the number of people that have contracted COVID and developed some degree of natural immunity. And then what I hope and expect we'll see a downturn as we come back towards the summer months. We will be in a different place, but I don't know that we will know enough or be ready to throw all of our social distancing and mask wearing aside. I think it's going to be a pretty cautious entry into the school year and the fall as we watch what COVID circulation looks like.
Dr. Haering, what's your best guess?
When we talk about getting back to normal, what I'm focusing people on is let's get back to better. Let's get back to a better society than what we were before. And what are the things that we want to change about our society and about ourselves personally, and take this opportunity because, I'm asking for something people have already been exercising the past 10, 11 months, and that is even more patience. it's exciting to have the vaccine, but when we have and as Delegate Levine, as you were saying, really to think about those people who are at high risk for hospitalization and even deaths, really to just be patient and recognize that we're working through this on an ethical framework and serving those at highest risk of severe disease first and frontline essential workers. I know there's been a lot of suffering. There's over 90 Alexandrians that have died. That's a lot of families and friends affected. There's been businesses that have been closed. Schools haven't been open. And I know this creates a whole lot of suffering. And I don't mean to be flippant to say we need more patience, because I know that's already been exercised and practiced. But really to stick with us and work with us. I can't thank people enough for where they've been. I do want to address an issue, if I can, Delegate Levine, about cancellations. We're asking people if they had reserved something to cancel their appointment later. If they don't, we have a backup system. And the backup system is called our No Waste program. To let people know, once you get into a vial, you have to use that vial it's a multi-dose vial. So with Moderna, there's 10 doses in each vial. Once you puncture it, you have to use that vial within 6 hours. And so what we have, and it's according to the prioritization group. So right now we have our police as backup, that they will come in at the end of our pod, and we have them like prioritized. We have all their cell numbers, and we call them and say, got to be here in 30 minutes. We call right down there, and that way we use 100% of our vaccine, and there's no wastage. Fantastic. And we'll continue to do that after we've done all the, because we've done that with healthcare workers, we're doing it with police. We'll do that, of course, with sheriff at the same time as police. Then we'll do that with our K-12 teachers and daycare providers, childcare.
So if people register with you, Dr. Haering, to get the vaccine, is that the best communication tool? You'll get to them when they're ready, when they're available? They don't have to
yes,
keep
sir.
calling you or bothering you?
That's correct. We will be notifying people, both those who are at highest risk and are not able to access the internet or whatever. We'll call them directly through the senior serving organizations. Others will be notified on a basis as appointments become available.
Now, again, it may be unfair because this isn't your job, Dr. Haering, but we do have people on this line who live in Arlington, who live in Fairfax, both of which have 1B, 1C available. I know that for sure. Can you tell me, to the extent that you know it, any differences, or is it largely done the same, to your knowledge, in Arlington and Fairfax counties?
I talk to the other health directors throughout Northern Virginia every day. We have a standing meeting every day, and we're catching each other up on best practices and how do we communicate better? How do we run pods more efficiently? How do we do our outreach to our community vaccinators better? And from what I'm seeing, things are done a little bit differently in every jurisdiction to some minor degrees, but in general, the processes are the same in terms of our prioritizations and our outreach.
Okay, I'm reading more questions. There have been a lot. Let me just keep going to them. Many of these questions we have answered.
I saw one while you're looking for one, if I can answer it. And people were saying, how can I volunteer? And I will tell you, I'll give you a website to sign up for it's called the Medical Reserve Corps. You do not have to be a medical professional. I think it should be called the Public Health Reserve Corps, but regardless, the website is alexandriava.gov, alexandriava.gov/medical reserve, alexandriava.gov/medical reserve.
Okay, so the question, do I need to wear a mask after 2 doses? The answer is yes, you do, because you may still be able to transmit the virus. You may actually get the virus just won't harm you, but you could still get it and transmit it, so absolutely wear a mask. This person says they scheduled the first date they could get a schedule. Lucky you. This person writes from Arlington is in March, but she wants to know if she could reschedule it because she found one this morning in February, but the system would not let her reschedule. She wanted to register in February and cancel her March appointment. I don't know, maybe she has to cancel March before she can do February. I don't know, but she was disappointed that she found a slot and couldn't take it. Any?
Yeah, I believe the system is set up that once you're in, you're not able to double book.
Okay, so
That's my understanding.
what she would have had
So-
to have done is actually cancel March and to grab that February, and there's a risk in doing that because she could lose her place.
Exactly, because then that other appointment would probably be taken that quickly.
Okay, so next, that question's been answered.
One that I saw, there were a couple.
Please, go ahead. Yeah, great. Y'all can answer what you say. Keep going. Yes.
A couple questions about the mass vaccination concept. Where are we doing those? Why are we doing those? And I have been speaking with different groups about the need to build infrastructure to do large scale vaccination, right? Like if we're going to get the population vaccinated by the summer, we've got to get to about 50,000 doses a day. That doesn't happen without the kind of mass vaccination effort that we're hearing about and seeing in other parts of the state. Now, right now, with 100,000 doses a week, we don't need that, right? We have more demand and more outlets than we can provide vaccine to. And so I see that as a strategy that we need to build and be ready to pull the trigger on when vaccine supply increases. And so there's active planning happening to deploy the National Guard to help staff those, to hire vaccinators or work with health systems and Medical Reserve Corps to make sure we have the vaccination staff in place. And that would augment all of the other channels that vaccine is currently coming through. But we don't need that to happen if we're only getting 100,000 doses a week. So it's a future strategy dependent on vaccine supply.
So Dr. Haering, when you call someone back, does it say Alexandria Health Department or does it say unknown? Because some of our folks don't, including me, don't like to answer unknown phone numbers. We think it's probably going to be some sales call or spam. How do you?
Delegate Levine, I'm not sure. I'm going to text somebody and we'll have that answer, I hope, in a few minutes.
Okay, great. Next question. Someone received the first dose back in January and actually 4 days ago, had a reservation. Name was found at the checkpoint, but at the injection table, the staff could not locate his name and was concerned whether it's been properly registered in the system. He's unable to log in at vams.cdc.gov, called Alexandria Department of Health, spoke with a helpful person, but was disconnected before the problem was resolved, and they called back and someone gave him with the CDC. So this is a very specific question, but it does relate, Dr. Haering, to an Alexandria citizen who is concerned that he's not being tracked right. Should he call back again and hopefully get the right person next time, or what?
In the system, it was an issue with the scheduling system.
Yeah, what he says is he had a reservation. His name was located at the checkpoint, but not at the injection table on an iPad. And he was concerned as to whether he's been properly registered. And his record card that he got after the injection says to schedule it, but he's unable to log in because he's not a registered user.
Yes, sir. I know. Yes, we're aware of that problem, and we apologize for that. Sincerely apologize for that. It's an error that we'll be fixing in the coming week. It has to do with what's called VAMS, the Vaccine Administration Management System, which is how people are scheduling. It's how we keep vaccine inventory. And we're actually, the state of Virginia is switching from that management system to another one in the coming weeks. And so,
what this guy to do? What should he do? Should he just call you? Is that the best way to?
No, they should watch for information that comes out by way of e-news to tell them when they will schedule their next appointment.
Okay, so all right, so someone will call him. He already had a vaccine. This is for appointment.
Yes.
Someone will call him so he can relax.
Yes.
Okay, even though it wasn't necessarily logged in right through VAMS, it doesn't matter. You'll still call this guy.
That's correct. They'll have information about scheduling for their second dose, because when we do second dose clinics, those will be for second dose people only until such time we're not seeing it fill up, and then we'll invite first dose people into it.
Okay. Can someone volunteer to help process people for vaccinations? And if they do, does that move them up the list to 1A to healthcare worker?
If somebody is a regular worker in a human service, a regular volunteer or worker in a human service organization or the Alexandria Medical Reserve Corps, they have to be an active volunteer. And, different organizations have different stratifications of what active means depending on how active they are. If it's Meals on Wheels, they're very active. They're out there every single day. So yes, they would be, but they will get that after they're working actively in a pod. I don't know that
for a while, and then they get to be 1A. They can't just.
Yes, sir, that's correct. And to answer your other question, we believe it's our number. It doesn't say Alexandria Health Department. It is our number, our phone number.
And what is your phone number so people know it's yours?
746-4988. And I'll put it in the chat box.
If you get a call from 746-4988, you better answer it, folks. It's not spam. It's real. Okay, let me go through some more questions. I think we've answered most of these. If y'all see one, you can grab it. I'm gonna, Dr. Avula, it's a question for Avula, although it really should be for Dr. Haering, I think. Dr. Haering, are there plans, I'm asking you because I think it should go to you, Dr. Haering. Are there plans to conduct mass vaccinations at landmark parking lot or other locations in the city of Alexandria? So that's really for you, Dr. Haering.
Like Dr. Avula was talking about, there are plans underway with a lot of different entities to do some massive pods, massive sites, but so a lot of this isn't yet to be announced because first of all, we need to see what the vaccine supply is and how that will be distributed across Virginia.
So I'm getting a consistent message, which is if people will register, you will call them, but because of limited supply, you're just gonna have to wait in line because it's just.
That's right. Exactly. Still register because then we'll know who to contact to say, okay, this week we're really focused on this group, and the next week this next group. When one of these larger regional pods opens.
So if someone registers with you, they might not get a call for 3 months, frankly, because you may not have enough vaccine. So, I mean, someone could register with you today and not get a call till May. I'm just being real. Given the amount of vaccine you have.
That's correct.
Okay.
And I should add a call from us or from one of the community providers that we're using.
And are you internally prioritizing? Like, are you prioritizing an 86-year-old over a 62-year-old with some medical conditions? Are you looking and doing that yourself?
Because the prioritizations were essentially by rollout, if you will, again, we had reached out to everybody to pre-register earlier in the week, last weekend even. And before it was even expanded from, as I described before, from the lake to the ocean, we had already captured a lot of people. So we're prioritizing by the fact that our 75 and older had the advantage of 5 or 6 days advantage of enrolling. So that's the prioritization, if you will.
So when I go to the theater, I know sometimes that I couldn't get the regular seats or the seats are really expensive, but the day of the show, I might be able to get in really cheap because you got 20 seats available, people didn't show up, and I can grab those seats, maybe for 20 bucks. Kind of seems like the same is true with the vaccine, right? Because you're into the pod, you've got some left over, maybe a couple people didn't show up. Is there a way for people to be on that, I'll come anytime, doctor, just call me up?
No, what we're doing, there's no way for folks to enroll in that at this juncture. What we're doing is we're following the 1B categories in what do you call it, in order, so that we're looking, and again, it's our no waste standby. So right now we have a list of police and sheriff. And then we have the list of what I had described before. So and then if somebody cancels way before the end of the day, we actually open up that slot, and for the person who happens to be looking on VAMS, the scheduler or whatever the next scheduler is, and that gets filled up immediately.
Okay, I think you posted where folks register for Alexandria. Where would they register for Fairfax or Arlington?
I found the Fairfax site just by Googling Fairfax County Health Department COVID-19 vaccine. And my guess is you can do the same thing with Arlington.
Yeah, I have on my website, markfordelegate.com, I have a link to my own COVID information page, and that has a link to Alexandria, Arlington, and Fairfax health departments. So my guess is it's there. If y'all can't find it, contact us and we'll make sure you can. A couple issues relating to DC. This person says, my private doctor's in DC, but DC won't let her give immunizations to Virginia residents. There are also people who live in DC and work in Virginia. And if you live in one, work in the other, vice versa, your doctor's in one. I actually have a DC doctor myself. Can you explain this interplay of geography? Should you seek the vaccine where you live, where you work, where your doctor is? Where should you go, Dr. Haering?
I think Dr. Avula remembers back in our training, any good public health answer starts with it depends, because there's so many different angles to this. I should say, first of all, if you're a federal worker and you work for the Department of Defense, the State Department, Bureau of Prisons, the Veterans Affairs Administration, then they actually have their own allocations, and you should go through their clinics, and the Indian Health Service. So those 5, you should go through theirs. All others can go to the jurisdiction, all other federal workers can go to where they live. People can enroll either way, where they live or work. We estimate, and this is just an estimate because we were, again, vaccinating people according to the categorizations in our 1A as well as our 1B1, that, our police and sheriff and firefighter, and even our K through 12. Most of them do not live in Alexandria. They live in Fairfax, Prince William, elsewhere. So we're vaccinating our workers and we're vaccinating our residents. And the same thing's happening across Virginia. We're vaccinating anybody who is eligible according to the categorizations.
Well, apparently, Dr. Haering, you're being much more generous than the folks in DC, because it looks like if you have your doctor in DC, they're not vaccinating Virginians. If you work in, we have people in DC. In fact, I heard a complaint by one constituent that folks in DC who work in Alexandria public schools are being vaccinated ahead of Alexandria residents. There's a lot of, they're getting it first kind of stuff going around. And I just want to say, it's not going to be a perfect system. There's no way to get it perfectly in line. I just want to give y'all a little bit of out on that. You should try to prioritize the people in the greatest need. But right now, there's such a limited supply that it's going to be a little bit random. But I guess, I don't know. How would you answer, Dr. Haering?
Well, when I hear that, what I will be doing is reaching out to the health officer in DC, as I've done with health officers in Charles County and Howard County, the other ones in Maryland. And the Maryland health officers have assured me that they're doing the same thing we're doing, that they will, if you're a healthcare worker working in Howard County or Charles County, they will vaccinate you. I don't know about private practices, but I'll certainly reach out to the health officer and find out if they're doing that or not. I want to reiterate that everybody that wants vaccine will get it. It's going to take some time. It's like Thanksgiving buffet. Not everybody gets their plate filled exactly at the same time, and we're serving as quickly as the food is being prepared.
So, Dr. Avula, I know we've gone an hour, and I promised you I wouldn't keep you more than an hour. Let me just ask you before you leave, is there anything else that needs to be said that hasn't been said that you want to make sure people know?
I think Dr. Haering's comment was right on point, and I would just add that as much anxiety as we are all feeling about our own situation, let's let those who we know, the data clearly shows us who is getting hospitalized and who is dying of this disease. And so if you're a 30-year-old EMT who got to the front of the line because you're a healthcare worker, and we've got an 80-year-old with underlying conditions, let's think about who's going to really suffer the impact of this and allow them to go first. I know that's an easier thing to say than it is to do, but we need to recognize, given the vaccine supply constraints we have, we need to get these to the most vulnerable right now.
Okay, thank you, Dr. Avula. If you have to go, I respect that. I know you probably have to go to Dr. Haering. I guess you can go if you want, Dr. Avula, and I do thank you for your
Okay.
time.
Great to
I
be
do
with
have
you,
a
Levine.
couple more questions for you, Dr. Haering, if you could stay for a few more minutes.
Yes, sir.
The question was, how many actual vaccines do we have in Alexandria? I think you said 4,300 and something. Is that right?
Well, it's a hard answer to answer. I have 0 vaccine available for people that don't have an appointment.
Right.
Okay, but we have appointments all next week, Tuesday, Thursday, Saturday, over 800 appointments for each of those days.
Open
and
day?
then
No, they're all full.
They're all full.
Right, of course.
They're full. So are you counting that as available? That's what I'm saying when I say it depends.
Right.
Those people that have an appointment, I'm telling them they have a vaccine waiting for them.
Okay.
Right.
And so when are your next appointments available? When's your first
So we anticipate getting vaccine on a regular basis, and we don't find out the exact number until we get it. So we'll get vaccine next week. And when we get that vaccine in, that's when we open up more more appointment slots.
So are they in March or April? When?
No, that would be the end of January and beginning of February.
So you may have appointments available as soon as the end of January, beginning of February, when you get more vaccine.
Yes, sir, that's correct.
So if people have registered with you, you're going to notify them, so they don't. As long as they've registered with you, they don't have to keep calling you. You can just tell them when it's available.
We will notify them. We won't call them. We'll email them, because if they've registered, that means they've been online. We'll email them, and again, it's going to be and like you said, it's a messy situation. There's going to be a race among them to see who gets it. This is just the way that it flows.
Okay. I have done my best, folks, to answer every single one of these questions that I've seen in some way or another. If I haven't gotten to it, the fault is mine. Dr. Haering, I know how.
Well, I think I've answered that last question that just came in. Somebody's scheduled for vaccine on January 21st.
Yes.
I have vaccine for you because you're in the queue.
Yeah. If you're scheduled, exactly. You're safe, go ahead and register. If you're not registered, and then Dr. Haering will get to you, whether it's January, February, March, April, or May. As long as you're registered, Dr. Haering will eventually get to you. And he's just stuck because there isn't enough vaccine available, but there is a line. And if you heard from Dr. Avula, basically he's saying, if you don't think you're in one of the high risk categories, there are levels of risk. If you're 93 years old, you're a greater risk than if you're 25 and a little overweight. Even though that's included, because 60 to 64 with body mass index, you can apply. Let's try to let the people who are most in need go first. And let's try to respect that, folks. Keep wearing your masks, keep your social distance. There is a light at the end of this tunnel. And please know that folks like Dr. Haering and Dr. Avula are working really, really hard every day. I don't know the last time Dr. Haering's had a vacation. He may not have one for another 2 years. He works 7 days a week, Monday through Sunday, which means no break at all. Let me just say on behalf of everyone in this room, just a thank you, to your staff, to all the hard work you're doing. We never know who our public health professionals are until we need you, until there's a pandemic. And this is your time to shine. And let me say that I have every indication, Dr. Haering, that the job you and Alexandria are doing are excellent. And we just don't have enough supply, but that's not your fault. And my hope is that it will increase in the future and you'll be able to take care of more of us. So thank you for your time and your transparency and explaining.
Thank you, Delegate Levine. And I also want to say thanks, as you did, to my staff, a tremendous staff, tremendous volunteers, but also to the city of Alexandria, they've been absolutely outstanding in multiple ways. We would not be where we are right now if it was not for the city of Alexandria leadership. In every single department, from the city manager's office all the way through, with the support that we're getting. I'm telling you, it's tremendous.
Thank you, Dr. Haering. I'm gonna let you go. You have a lot more work to do. I'm gonna stick around for just a couple more minutes. Thank you, Dr. Haering. Really, really appreciate it. Just for a couple minutes, if there's any question that I didn't answer or didn't get answered, post it now. I see lots of thank yous, which is fine. I really tried to get to all the issues, but if I missed one, because there were a lot coming fast and furious, post it now. You got 1 minute, and I'll try to answer it myself. Otherwise, I'm going to assume I got your questions answered. I see no more questions. That's a good sign. Let me say to all of you, thank you. We had north of 80 participants here. Kathy asked, is Alexandria following Northwood? The answer is yes. So I think we've got the idea, right? Lots of people are eligible. 4 million, half of Virginia is eligible, but that doesn't mean you're going to get your vaccine tomorrow. It means you should register and you'll get it in time, but there just isn't enough vaccine available. You know, that's the answer. It's not a completely satisfactory answer, but it is coming. And, that's, you know, it's always been my view that you should know the truth, whether it's the hard truth or the easy truth. I think the answer is it's somewhere in between. We are getting a lot of people vaccinated, but we still have a long ways to go. And no one likes this pandemic. And, but hold firm, stay true. We're going, Betty Hill says that there's no way in Arlington to cancel an appointment. Yeah, I guess I would say for you, Betty, that if you can get one in March, that's pretty good. You know, you can call Arlington, but lots of people can't get it for some months to go. So, and as you heard from Dr. Haering, they're doing their extra vaccine for our public safety officers. They call them when they have excess, so none is wasted. Thank you, everybody. Thank you for your time. Obviously, when you go out, wear a mask, keep your social distance, wash your hands, be careful. By all means, don't be in some indoor place where people aren't wearing masks. Just step away from those people. They're harming themselves and they could harm you. So just be really careful. We will get through this. We will absolutely get through this as a nation. In 4 days, we're going to have a competent president of the United States. And it may get even faster. It may get even better. We may have a new AstraZeneca in April. So let's hope for the best. And again, I want to thank everyone for their time today. Y'all have a great weekend. Take care, everybody. Bye.